Good morning, everyone, and welcome to our webinar on obesity and the heart. I request Professor Edwin Kennedy to introduce today's speaker, Dr. Narra Lavanya. Sir, can you
Thank
start?
you.
Yes.
Thank you. Thank you, Dr. Nadeem. Thank you so much for getting Dr. Lavanya, and thank you so much for this entire concept. You know, friends, we have moved into a new spectrum when it comes to our webinars. We have so far under the India biggest weight losers challenge, we have so far completed about 7 webinars. And by design, these preliminary webinars all related to the simple subject of health. And we spoke about nutrition and diet and exercise and the psychology of stress and fasting and success stories, alternative therapies, and so on, subjects that are commonly and comfortably understood by most of us. From this point on, we move into very specialized aspects of our emphasis, which is obesity. And we now move into the medical realm, in which we will invite practicing doctors to talk about the relationship of their specialization with our need, and that is to manage obesity. We beam this program through social media to over 100,000 individuals. Now, today we have selected a topic, obesity and the heart. And if you were to look at the relevance of that topic, obesity and the heart, you realize that about 50 to 60% of the human population overall, in spite of poorer sections of society, 50 to 60% of humans are overweight. That is one aspect, the obesity aspect. The second aspect relates to the heart. And 60 to 80% of humans, or Medicare costs, or mortality is related to the heart. So this topic is vitally relevant to our program today. To talk about this, we have, as Dr. Nadeem has mentioned, we have Dr. Lavanya. Now, I don't quite know whether I should introduce Dr. Lavanya as an academic or a cardiologist. And I have to tell you that I realized that Dr. Lavanya was both an academic and a practicing interventional cardiologist. We are privileged. We are certainly privileged. If you look at it from an academic perspective, Dr. Lavanya is a gold medalist, which means, of course, that she came first in her MBBS, and that is outstanding. And if you go beyond her MBBS, MD, DNB, an MSc in cardiology, and if you go beyond the qualification, or you go beyond the country, she embraces certification from the UK, the United States, and most interestingly, if I am fortunate to be able to talk with Dr. Lavanya again, she is certified in cardio-oncology, which is the second largest killer globally, and that is cancer. Remarkable. We have an interesting speaker with us today. And when you talk about obesity and the heart, I quickly reviewed it, and I came up with blood pressure, diabetes, hypercholesteremia, irregular heartbeat, so many things. And Dr. Lavanya is a specialist of this. She has presented more than 20 papers in national and international seminars. She has more than 20 publications, again, in national and international journals, in cardiology specifically, and 10 chapters in reputed textbooks and handbooks on cardiology. Ladies and gentlemen, I cannot say enough. Let me just say welcome to Dr. Lavanya, who, because of her very tight schedule, we recorded her last evening.
Srikanth. Sir, you can unmute, sir.
Can we have some volume, please? Ms. Shrikant, can we have some volume? I can't seem to hear.
Today we are going to talk about the cardio-obesity conundrum. Basically, we'll be talking about what effects obesity has on cardiovascular system, or in simple terms, the heart. So I'll be going through the introduction, the factors causing obesity, what the World Health Organization talks about obesity, what are obesity and risk factors, what are the changes in the heart or the cardiovascular system which are associated with obesity, what are the lab investigations we do in patients with obesity, how do we manage obesity, what are the public health solutions for obesity, and then finally my take-home message. So to begin with, worldwide, obesity has almost tripled. That is, it's become 3 times more than what it was since 1975, and at least 2.8 million deaths annually, that is every year, are occurring because of some or other adverse health outcome due to obesity. Among those deaths, 67.5% of those deaths are because of high BMI, and those are mainly because of cardiovascular disease. So what exactly are these cardiovascular diseases? They include myocardial infarction, or what we call a heart attack, stroke, that is a brain stroke, and something called heart failure, which I will be talking about in detail. And early detection of cardiovascular risk is very important in reducing both the high death rates as well as all the hospitalizations which are occurring because of overweight and obesity. So obesity per se contributes to well-established cardiovascular risk factors, and they mainly include type 2 diabetes mellitus, dyslipidemia or high cholesterol, elevated blood pressure and hypertension, and something called obstructive sleep apnea or OSA. Again, I will be discussing in detail. So, what exactly causes obesity? So, we all know in simple terms, when your energy intake is more than your energy expenditure, that you're taking more diet or more food, but you're using less of that energy, you become overweight or obese. Not just diet, there are other risk factors which contribute to obesity. Most important among them is a genetic predisposition. So, in your family, your parents, your grandparents have obesity, even you are much more prone than normal people to become overweight or obese. And not just genetics, there are certain neurobiological factors and psychological factors. Anxiety, depression, stress, overeating, all of these can also contribute to overweight and obesity. And also socioeconomic status. Being rich also puts you at much higher risk because you're overeating and not working as much as what your body needs you to work. So, what is the impact of obesity on your cardiovascular system? So, your cardiovascular system includes your heart, your blood vessels, as well as the blood vessels in your brain. So, we already said the risk factors are diabetes, hypertension or high BP, high cholesterol, and obstructive sleep apnea. So, what this obesity does to your body is it causes something called atherosclerosis. So, what is atherosclerosis? The bad cholesterol goes and sits in the blood vessels of your heart, your brain, your legs, and it causes heart attacks, brain strokes, and peripheral arterial disease. It also causes something called heart failure. So, what is heart failure? Is your heart is not pumping normally, or it is pumping at a reduced function. Also, it can cause arrhythmias. Arrhythmias are abnormal electrical activity in your heart, the most common one being the atrial fibrillation. Your heart is not beating normally, it is beating at a very high and an abnormal rate. Obesity also can cause thromboembolism. So, thromboembolism is the formation of clots in your lungs as well as in your veins of your legs. And it can also contribute to something called valvular disease. Your heart has 4 valves, and because of obesity, the most common valve which is involved is the aortic valve, which is a valve which is there in the most important artery in your body. That's the aorta. So the WHO, the World Health Organization, is recommending the BMI cutoffs of various population. The Caucasians are the white people. You can see that in them, obesity is defined when the BMI is more than 30. BMI is nothing but your height and your weight ratio. So when the BMI is more than 30, the white people are called obese. But when you see the South Asians, the Chinese and the Japanese, obesity comes when the BMI is more than 25. Why this difference between white people and South Asians or Indians is we are at a much more higher risk of obesity as well as cardiovascular diseases, that is heart diseases. So our BMI cutoff makes us obese once we are more than 25. And this shows the extra amount of risk we are than compared to the white population or the Western population. So what exactly, how does this obesity impact our heart? So like I said, your intake is more. You have a poor nutritional quality food, you're eating highly processed food, or you're taking a lot of added sugar content. And on top of that, you have a sedentary behavior, like you're a couch potato, not moving around much, and your physical activity is very limited. On top of that, you have a genetic susceptibility. That is, you have a family history of obesity, you're under a lot of stress, you are smoking. All these are risk factors for developing obesity. So normally what happens is we have 2 kinds of fat in our body. One is the subcutaneous fat, that is what is there under your skin. And one more, something called the visceral fat. Visceral fat means the fat which is around your organs. That might be around your liver or around your heart or around your kidneys. So when you're subcutaneous, the skin fat is more, you are at a low risk for diabetes or heart disease. But when your visceral fat, the fat around your body organs is more, you become at a much more higher risk of developing both diabetes and heart disease. So that is why cholesterols or obesity, they lead to this deposition of unhealthy fat around your organs and make you at a much more risk to develop all these problems. So let me talk about obesity and the risk factors in detail. So like I said, diabetes and obesity are very, very strongly related, and about 80 to 85% of people with diabetes, they're either overweight or they're obese. And in return, obese people have a risk of developing diabetes 3 times more than normal weight individuals. And that is why it is very important to start screening for diabetes early. If you are overweight or obese, at least at the age of 45, you should start screening for diabetes in this population. Coming to hypertension and obesity are directly related. So as the amount of weight increases, your blood pressure levels go on increasing. And like we said, the visceral fat, the fat around your major important organs of the body, that is a bad fat, and that also increases the risk of you developing hypertension or high blood pressure. When you're obese, there is an increase in the blood volume in the body, and that also increases the level of BP in your body. And not just that, obesity increases the arterial stiffness. Normally, your blood vessels are elastic, and that's how the BP is maintained. But once you're obese, the arterial stiffness comes down, and that also leads to hypertension, and it leads to early hypertension, especially in children. What about high cholesterols? Mainly, there are two different types of cholesterols. What we call the bad cholesterol or the LDL cholesterol, that is the low density cholesterol, and the good cholesterol or the HDL cholesterol, that is the high density cholesterol. So your overweight or obesity decreases the bad cholesterol. It decreases the good cholesterol and increases the bad cholesterol. And weight loss is something which decreases this cholesterol levels, and it will help you to lead a more healthier life, which is having a reduced risk of cardiovascular disease. And obstructive sleep apnea also leads to the development of hypertension and leads to heart failure and abnormal arrhythmias. I will talk about this in detail later. So what all changes happen to your heart and the cardiovascular system when you're obese? So there can be a lot of ECG or electrocardiographic changes in your heart because of obesity. There can also be a lot of hemodynamic changes. Hemodynamic changes are something where your blood volume increases, where your arteries become more stiffer, where your pressures inside the heart increase, and that is not good for your heart. They can also cause a lot of structural changes in the heart. Mainly the heart becomes enlarged, the chambers become enlarged, a lot of fat deposition happens around the heart, which is again not good for your heart. Also, there are a lot of functional changes. Like we said, it can lead to heart attacks, it can lead to brain strokes, it can lead to clot in your legs as well as in your lungs, which is all life-threatening and leads to hospitalization. So let me talk about each of these in detail. So obesity and coronary artery disease. So what happens when we are obese? We already said the body fat is increased, the visceral fat is increased. So there is a lot of inflammation in your body. The bad cholesterol is increased, and all these go and deposit in your blood vessels. When this deposition happens in your blood vessels, the blood vessels get blocked, and that can lead to heart attacks, that can lead to brain stroke, and that can lead to limb ischemia. That is, the blood flow in your limb is stopped, and that can lead to amputations. The limb might have to be cut off. So the treatment for everything starts off simply with your lifestyle interventions. You have a calorie restricted diet, you increase your physical activity, you go for a weight loss. And if all this is not working, you might have to meet your doctor and go for a medical therapy or even surgical therapy sometimes. What about obesity and heart failure? So like I already said, heart failure, it can be of two types. Heart failure with reduced ejection fraction, where your heart pumping per se is decreased and the heart is unable to pump properly. And heart failure with preserved ejection fraction, where the heart pumping is normal, but it's unable to relax properly. So both these conditions will lead to increased hospitalizations. You are unable to breathe properly, you can't exercise properly, there is fluid accumulation in your limbs, in your lungs, you're always breathless, you cannot sleep at night. And that, again, weight loss plays a major role in this, along with lifestyle changes. And you need to be on medical therapy for heart failure, and probably for weight loss, again, you have to be on medications or undergo surgery. Coming to obesity and dyslipidemia. Dyslipidemia, like I said, is high cholesterols. Again, obesity will lead to accumulation of bad cholesterol, which we said either the LDL cholesterol or the triglycerides, and VLDL, which is all bad cholesterol, and it decreases the level of good cholesterol, which is high density cholesterol. So all these cholesterols again will go sit in your blood vessels and cause blockages, causing heart attack or brain strokes. They can also go and deposit in other organs like the liver, and they cause something called the non-alcoholic fatty liver diseases. Again, the management remains the same: lifestyle changes, weight loss, And if not working, your doctor will always suggest medical therapy or even surgical therapy. So what about arrhythmias? Like I said, arrhythmias, they are the abnormal electrical activity in our heart. We all have an inbuilt electrical system in our heart, which makes our heart beat normally, which is called a sinus rhythm. When this is disturbed because of excess fat tissue, your heart is getting remodeled, it is getting enlarged, there's something which develops, that is the abnormal electrical activity. Like I said, atrial fibrillation is the most common one. We all see now, even Apple watches have the atrial fibrillation detector. So that tells you that your heart is not beating normally. So again, that increases the risk of hospitalization and worsened life pattern. So the management remains the same. You have to change your lifestyle, weight loss, medical therapy for the arrhythmias, and maybe sometimes even devices might be used for this arrhythmias. Coming to obesity and obstructive sleep apnea. So what is this obstructive sleep apnea? When you are overweight or obese, all the excess fat gets deposited around the neck. It narrows your airways. So when you are sleeping, you are not able to breathe properly and you start to snore. Also, the excess fat goes and deposits around your chest and abdomen, and your lung volumes decrease and you're not able to breathe properly. So basically, you're obese. There is fat around your neck, your abdomen. You're not able to sleep properly because your airway is getting obstructed, because of which your sleep is not completed. Next day, you're very irritable, you're fatigued, you're tired, your memory is low. Because of all this, you're depressed. Again, you eat some more. Again, you gain weight. Again, you become more obese. So it's a vicious cycle, and this worsens your high blood pressure and your sugars, and the insulin resistance goes up, and even your brain function comes down. So if anybody is having a history of snoring, you're not able to complete your sleep, you're waking up after 2 to 3 hours of sleep, you have to get evaluated for your obstructive sleep apnea, because it's a very silent killer and it can cause heart attacks and brain stroke like any other risk factor of diabetes and hypertension. Again, the management is the same. You have to lose weight, because even 5 to 10% of weight loss can significantly improve your symptoms. Sleeping on one side can help you reduce these symptoms. Regular physical activity, mainly to improve the weight loss. Smoking and alcohol should be avoided. And if this is a major issue, you're not able to sleep, you're not able to complete your sleep, you definitely have to get evaluated for this OSA. This is diagnosed by something called a sleep study, which your doctor will advise you for. And what are the tests in patients with obesity? What exactly they need to do and what has to be checked? So in these patients, we have to check the renal function test, that is the creatinine and the electrolytes, because kidney issues can develop in these patients. HbA1c, what we call the glycosylated hemoglobin. This will tell you your average sugar levels for the last 3 months. So if you're not a diabetic, you'll know whether you're a diabetic or not. And if you are a diabetic, you'll know whether your sugar is under control or not. Lipid profile, like I said, we have to know what is the level of good and bad cholesterols in your body. Liver enzymes, because like we said, if you're obese or overweight, this fat can go deposit in the liver and cause something called non-alcoholic fatty liver disease. You have to check your CBC, that is your WBC count, to look for any infections. Thyroid, most importantly, most missed. Many of obese patients develop thyroid dysfunction, so TSH should be checked. Uric acid, again, obesity can lead to gout because of uric acid deposition. We have to look for vitamin deficiencies, both iron and vitamin B12 and D should be checked. Again, urine analysis to look for renal problems. And in case of females, we have to look for hormone imbalance by doing the basic test to see, because obesity causes a lot of hormonal imbalance in the body. So what are the treatment strategies for obesity? The main treatment strategies include dietary modifications, physical activity, and then followed by pharmacotherapy, or if required at extreme stages, bariatric procedures. So the management, like I said, first starts off always with non-pharmacological. That means non-medical. Always we advise the patient to go for lifestyle habits first. This followed by calorie restriction. We advise dietary modifications, and only when this is not controlled in patients with severe obesity, then we go with medications or surgical and endoscopic procedures. So what are the diet patterns for weight loss? Diets which reduce the risk of cardiovascular disease are mostly plant-based, and they're hypocaloric. They're low in calories and Mediterranean. This simply means that you have to take a lot of fruits and vegetables in your diet. Avoid processed and refined sugars, and preserve the lean muscle mass, take more of protein-rich diet, avoid red meat, and you can also stick to patterns like intermittent fasting or time-restricted eating just to prevent yourself from eating a lot of food even when you're not hungry. Also, you can stick to low to moderate carbohydrate diets with low fat. The takeaway from this entire slide is you have to take your diet with high protein, low fat, and low carbohydrate, keeping lots of fruits and vegetables, lot of fiber filled diet, and avoid all kind of processed foods or any food that comes out of a packet. And most importantly, physical activity. So what physical activity helps you do is it not just helps you to achieve weight loss, but also it helps you to maintain your weight. It improves your blood pressure, it improves your sugar levels and also your cholesterol levels. And it also helps you to preserve and build your muscle mass. Not just that, once you work out, do some kind of exercise, your mood is improved, you sleep well, and overall your well-being is improved. And it reduces both diabetes, hypertension, as well as heart problems in the long run. So what kind of activities you can do? Normally, physical activities divide into aerobic, resistance training, and flexibility and balance training. So aerobic activity, the American Association says that you can do 150 to 300 minutes of physical activity per week if you are doing a moderate intensity activity. That could be walking or cycling or swimming, whatever the choice it is. Or if you're doing a vigorous activity, it could be 75 to 150 minutes per week of vigorous intensity physical activity. And resistance or strength training is very important. Just doing aerobic is not important. So at least 2 to 3 days a week, you have to do resistance training, which could be weight training or resistance band or body weight exercises. And also 2 to 3 days a week, you can do your flexibility and balance exercises like simple yoga, stretching, or any balance exercises which you are comfortable with. Basically, doing all these exercises increases your energy expenditure and promotes fat loss. Your insulin sensitivity is increased, your heart and circulation are improved, and your physical tolerance level increases. And that is very important for your heart health. Not only that, it reduces both your stress and improves your mental health. You might not have to start everything together. You might always start small, start walking, then start running, and probably start picking up this physical activity one by one. Aim for consistency. Don't plan to be perfect from day one, but always aim for consistency and discipline, and then you can continue this for a longer time. So, and what about medical therapy? There are a lot of medications available now for obesity, which your doctor will prescribe to you. These are for the people with a BMI of more than 30, that is, who are obese, not for overweight people, unless they have risk factors like diabetes, hypertension, high cholesterol, or OSA. These are advised only by your physician once you are not able to achieve weight loss or that high weight is creating a lot of side effects and problems for you. So this medication is only on prescription basis and will be titrated by your doctor, not to be self-medicated. We always choose physical activity and lifestyle modifications with dietary modifications than going to medication. Only in those patients with high risk factors will we go for medical therapy. And if the medical therapy is also not working, the BMI is more than 40, there are certain endoscopic and bariatric surgery procedures, again, which will be advised by your doctor. So until then, till we try maximum with medications, not working, only then the surgical option will be given to you. So what about the public health solutions per se? So we know you have a problem, you go to your doctor, you get your lifestyle adjusted, you get the physical activity routine done, or you go for medications. But obesity is such a big problem in our country right now that the implication of these guidelines should be done at a much earlier level. We should teach the children not just at workplace, at schools, at workplaces. Even the laws and policies should be such that the nutrition quality should be improved. Personally, what we can do is sedentary or sitting time. They said sitting is the new smoking. So sedentary and sitting time should be reduced to the bare minimum. If you have a desk-bound job, every 20 to 30 minutes, please get up from your chair and move. Walking around, even in your office, makes a lot of difference. Every 30 minutes, take a 5-minute break, get up from your chair and move around. That makes a lot of difference. Keep walking for short distances. Instead of using your vehicles, please walk that short distance or go for a small jog whenever you're free. It doesn't have to be morning, evening. You have to move. Sitting does not help you in any way. So you have to move around, and that reduces the risk not just of your diabetes or your hypertension or your high cholesterols. It improves your entire mood and your life as well. So doing all these improves the entire population health, decreases the prevalence of obesity, and reduces heart problems overall. All this reduces the burden on healthcare, and it reduces hospitalization to a much, much higher degree. So, what we would like to say at the outset is obesity, we know, is a chronic disease. It can cause each and every problem, starting from hypertension to diabetes to high cholesterol to abnormal electrical activity to heart attacks and heart failure. Over 50% of adults are overweight, and that is a very astonishing number. And even more than that, are becoming obese now because of the unhealthy diet we are taking, the sedentary lifestyle we are following, because of the environment which we are living in, and so many psychosocial factors where there's anxiety, depression adding to all these. And all the risk factors ultimately lead to cardiovascular disease, leading to high risks of deaths and hospitalizations. And this affects the most earning economic population of our country, which is making us much backward than anything else. So knowing that obesity is such an important and a chronic disease, we have to focus on that. We have to change our lifestyle. We have to take a healthy, calorie appropriate diet, regularly have some amount of physical activity, adequately sleep to 6 to 7 hours per day, manage our stress well, and only if all this is not working, we then move on to pharmacotherapy or surgical procedures for those patients who are not able to lose weight in this way. Always prevention is better than cure. So always start early, start walking, and only then you can run. So lifestyle interventions always remain first on any doctor's treatment list of obesity and overweight. Medications are only add-on when this is not controlled by lifestyle interventions. And then surgery comes only for those patients who are not able to manage with all these things. And ultimately, the goal is weight reduction, because finally it reduces the risk of cardiovascular disease. Thank you.
Thank you, Dr. Lavanya. Thank you. I may be wrong, but I tend to see Dr. Lavanya on my screen over there. Dr. Lavanya is present? Yes?
Yeah. Hi.
Oh, well done.
Hi.
Thank you, Dr. Lavanya. We
Thank
can
you.
thank you in person for that inspiring and emphatic. Your last few sentences, we have to. You did not say we should or we should try. You said we have to. And then you emphasize prevention is better than cure. And as a doctor, you warmed my heart. Of course, you're a cardiologist, but nevertheless, as a doctor, you warmed my heart by saying lifestyle change, the simple factors that you can control, your diet, your activity, your sleep, these are in your control. And coming to a doctor is your second choice when you have failed yourself. I mean, I think that is beautifully said. Coming from a doctor, it inspires us health professionals. But as always, Dr. Lavanya, we health professionals tend to be slow in understanding some of the deeper aspects of medicine. But I'll ask you 3 or 4 simple confusions in my mind. Now, in the causes of obesity, certainly we understand the relationship between food and exercise and the metabolic structure, etc. But you brought up 3 other interesting points. 3 interesting points. You spoke about genetics as a relevant aspect. You emphasized socioeconomic, and your statement was, the richer you are, the fatter you get. I remember that statement. I mean, that's an amazing statement to make. The richer you are, the fatter you get. And then you went on to talk about some of the psychological aspects, and you spoke about depression, you spoke about anxiety, and you correlated that with obesity. I mean, you know, the the connection is remarkable. Just a few explanatory thoughts on these three aspects. The genetic aspect, you emphasize that it is relevant. The richer you are, the fatter you get. You mentioned that. And the third, your mental attitude, anxiety, etc., can also cause obesity. If you can just explain that in a few simple words, Doc.
Yes, I think actually you covered my points pretty well. So we all know that obesity is something we already said energy expenditure is much less than our energy intake. But genetic predisposition or genetics is something which comes from your familial down. But that is not the reason for you not to lose weight. Okay, there is I think, a quote we have all read: obesity does not run in the family. No one in the family runs, right? So this is a very common statement which we all keep hearing. But jokes apart, but I would say obesity is a serious genetic condition as well, but that doesn't make it an excuse to not lose weight. There are options. If lifestyle is not working for those who are genetically obese, there are medications, there are surgical procedures. So because this is something which is life threatening, obesity is not just you having a few extra kgs or a few extra pounds. It is your very high risk. Obesity is a life risk factor. So I think if you are obese from a genetic point of view, that does not make you any less to go and get any treatments. So yes, genetic predisposition, very bad. But again, like you said, lifestyle and the psychosocial aspect of it. A lot of psychiatry patients or even simple anxiety depression patients, these are the people who don't want to do anything, who are not interested in their health or their lifestyle because they think there is nothing in it for them, because they are anxious or they're depressed or whatever it is. So these people also, obesity comes to them because they're not moving much, they're not doing any kind of physical activity. So simple lifestyle counseling itself is enough for these people. Medications might not even be required. But the thing is, you have to identify these patients, the anxiety, depression patients. You just don't have to push them away saying that it is simple anxiety or you're just depressed. You have to treat the root cause, talk to them, counsel them, and advise them for lifestyle modification. And yes, financially, the finance part of it, yes, the richer you get, you because you have no resource limitation, you're free to eat whatever you want. And that is one of the most common causes right now of obesity in our country. It is because teenagers have access to funds. I think as kids, we had limited pocket money. Now that concept is not there anymore. The kids have access to all kind of financial resources, all kind of junk food is available. And that is the most important reason for this growing, I would say, pandemic of obesity, not just in our country, but also this has already been seen in the US. We are following the same Western trend. So I think, yes, people with access to more finances are putting on more weight and becoming more obese. I think all these factors have to be kept in mind, that genetics, your behavioral anxiety, depression, and finance part of it play a very, very important role in increasing the prevalence of obesity.
Thank you. Thank you for that. Now, Doc, we have all heard of the heart attack, but you spoke about something called heart failure. Okay, that's one question. I'm going to take it a little further in your next talk. In the next portion of your talk, you spoke about subcutaneous fat, and you said that, well, that could be a causation of diabetes. And then you spoke about visceral fat, and you said, well, that has a major impact on the efficacy or efficiency of the organs. Heart failure, Doc, can you tell us a little bit about that?
Yeah, so heart attacks, like you said, everybody knows. There is a blockage in your blood vessel, you develop a heart attack. Heart failure is a much less known entity. So what exactly happens in heart failure is, heart is a muscle. Basically, it's a muscular pump. So when that muscle weakens, that is what leads to heart failure. So basically, your muscular pump is not working properly. Either it is not able to pump properly or it is not able to relax properly. So that is what causes heart failure. And obesity directly leads to heart failure. And believe me or not, heart failure is more deadly than most of the cancers in the world. And I'm talking the mortality, that is the death rate of heart failure is equivalent to leukemia. So that should put it in perspective that how bad this disease is. And most of our population is not even aware what heart failure is. So you have to get an echocardiogram, a screening test of the heart, to know how your heart pumping is, especially when you're a diabetic or a hypertensive and you are obese. So an echocardiogram will tell you what is your heart pumping and whether the pumping is decreased or not. So that is about heart failure. Yeah, and I think you said about subcutaneous and visceral fat. So in simple terms, subcutaneous means below the skin. So whatever fat is below the skin, we say it's a good kind of fat deposit because it helps you to eliminate whatever energy you are taking more. But visceral fat is around the organs. It can be around your liver or your kidney or any major organs in your body. And this fat doesn't do any work for you. It is just lying there and getting deposited, and that is leading to your obesity. We call it dysfunctional fat. That is fat which is of no use. Normally, the skin fat, what is there, it is the one which gives us energy. So that fat is utilized. But the fat which is there around your organs does no work for you except getting deposited and making you overweight and obese. So yes, good subcutaneous fat, good skin fat helps you. Bad visceral or organ fat makes you more sick. I hope I made that
Okay,
clear.
okay. That's an interesting explanation. You spoke about good fat and bad fat. Now I'm going to take that explanation that fat under the skin, which you referred to as subcutaneous fat, is good and it gives you energy, and fat within the body around the organs is perhaps dysfunctional. That's good. There's another area in which you spoke about good and bad, and that is good cholesterol, bad cholesterol, and triglycerides. Now these are, to a simple mind, these are fat. How can it be good, bad, and what is a triglyceride?
Right. Right. So, like I said, the same concept of subcutaneous and visceral fat, even the cholesterols are good and bad for us, right? So, whatever this LDL cholesterol or low density lipoprotein cholesterol and HDL cholesterol, high density lipoprotein, the HDL is the good cholesterol. In the sense, it takes out all the bad things out of the body. We call something as a liver circulation or enterohepatic circulation. So, the HDL cholesterol keeps good because it increases. It decreases the inflammation and increases the antioxidants. Whereas the bad cholesterol, the LDL cholesterol, again goes and deposits in your blood vessels, which you said is the cause for heart attacks. Your heart attack is caused by this bad cholesterol going and sitting inside your blood vessels and blocking that blood vessel, ultimately leading to a heart attack. Whereas the good cholesterol is the one which tries to remove this LDL cholesterol away from the circulation and it keeps it in the blood. But bad cholesterol sits in your arteries and blocks everything, not just the heart, even the brain, even the leg, which is called peripheral arterial disease. So the bad cholesterol is going and sitting everywhere and clogging your arteries. So that is why you need to keep your bad cholesterols as low as possible, less than 70 for people who are high risk, and less than 50 who are even more high risk, we say. So HDL cholesterol, you can increase mildly by taking good amount of dry fruits, but LDL cholesterol is something which you have to keep it under control. If not by lifestyle, there are medications which we call statins or cholesterol lowering medications, which keeps the LDL cholesterol under check. But that is essentially what it does. Bad cholesterol sits, deposits in your arteries and blocks them.
Doc, now you seem to have spanned the entire spectrum. I'll tell you what I mean. It says over here, cardio-oncology. Now, what exactly is that? Cardio-oncology. I know oncology deals with cancer and cardio deals with the heart, but where do we merge these two things?
Yeah, so cardio-oncology is there since time immemorial, but it's becoming, more relevant now because the number of people who are surviving cancers, we have very deadly cancers, but they're excellent chemotherapy and radiation for the same. And these survivors often end up in what we call heart failure. I am a heart failure specialist, and since I specialize in this, I also had an interest in the cardio-oncology part of it because all these cancer patients, as you give them chemotherapy, the heart pumping comes down. The heart muscle gets affected by all the chemotherapy agents, which is usually not checked. So every person who's undergoing chemotherapy or radiation or any cancer related therapy should meet a cardiologist first and look at least a basic ECG and an echocardiogram to see what the heart pumping looks like. Because down the line, as you keep taking this chemotherapy, your heart pumping can go down. And there are medications which can actually reverse this so that your heart pumping is not reduced. So it is very important to identify. If you have to treat, you have to identify. So you have to know what is your heart status before starting the chemotherapies so that we can prevent this from worsening. Because like I said again, the patient doesn't die of cancer. He ultimately dies of heart failure, and which is a very sad and sorry state of affairs, because most people are not even aware that cancer drugs can cause heart failure. So I think this awareness is very, very important. And that is what I am trying to do with my patients, bring awareness about heart failure, bring awareness about cancer-related heart failure. So that is the way forward, because cancer has become such a disease which we have actually gained victory over, which was not heard before. And now that patient is cancer-free, but he's dying of heart failure and the heart attacks, is a very sad state. So I think a lot of awareness is needed there.
Now, I'm going to take advantage of talking with you right now, Doc. Just the other day, I was with a friend, and we went to meet a doctor in one of our leading hospitals. And I recall that the friend of mine paid about 1,000 or 2,000 rupees for a consultation, and I'm going to take it for free on this line now. Yes. Now, what I'm going to ask you is this, Doc. Tucked away in your entire PPTs, in your entire explanation, was a word that stood out for me. It said, let me see, I've written it down here. It said, well, even if I haven't written it down, I remember it in my mind. It said sarcopenic obesity or some such thing. Now, let me see where it is. But sarcopenia, what, and I'll tell you why I'm asking you this, Doc. While I look for it, I'll tell you why I'm asking you this. I'm 78 years old, and I was about 90 odd kgs, and my wife was persisting in telling me to lose weight, and then lo and behold, all of a sudden I lost weight, and I, of course, was worried about that other word you use, oncology. So I was certainly worried about that. And I went to my doctor and I said, Doc, am I in trouble? And he looked at me and did whatever investigations and he did. And he came up with the same word that you spoke about, sarcopenia. Now, that would mean something like losing muscle mass or some such thing. Is that what it is?
Yes, that's what, absolutely. So a lot of people, as they age, they tend to retain the fat. Like I said, the visceral fat is not something which goes away easily. So you tend to retain your visceral fat, but all the protein in your body is lost. Because as you age, your intake changes so much so that your food intake comes down. Elderly people or people more than 65, 70 eat very little. And whatever they eat is mostly made up of carbohydrates. And carbohydrates is not going to do anything for your muscle. So slowly you start losing muscle because there's no protein intake and you just end up retaining the fat. So you might look overweight or obese, but that is not true. You have to see what is the ratio of your protein and what is the ratio of carbohydrates. Similarly, what is the ratio of the fat and what is the ratio of your muscle in the body. So that makes a lot of difference. That's why a lot of lean looking people might not have good muscle mass, or a lot of overweight, obese looking patients might have good muscle mass. So that ratio has to be checked separately. What is your muscle and what is your fat? So that is an entirely different way of looking at things, especially in the elderly, because everybody who is looking overweight and obese might not really be overweight and obese in this elderly population.
I'm not going to take more advantage of you than I already have, Doc, but I am going to ride on your sentence with which you completed your presentation, and I'm going to use that as a statement from my side to close my association with the webinar today. You said that it is vitally important. Obesity is rampant at above 50% in most human populations or countries, including our own. And you said it is so important from a public health perspective to educate people in the workplace, to educate our children in schools, to make available facilities in the park, and to do things like Dr. Nadeem does, which is build gymnasiums and things like that. I want to thank you for that. And I want to add to that, the Indian biggest weight loser challenge is exactly that. I mean, we picked up this one subject, obesity, because we believe that it caters to a large population. And that single word obesity has given us over 100,000 hits on our social media. And here is a profoundly academic medical professional with as many publications as you have, and you are emphasizing that education, public health is the need of the hour. I want to thank you very much, Dr. Lavanya. I'm an old man and I have been in this space for 40 or 50 years, but you have taught me new things, and I thank you for that. Thank you for that.
You so much.
Thank you so much, Dr. Lavanya. We are so grateful for your presence. Dr. Nadeem, you are going to close this session, sir.
Yeah, thank you so much, Dr. Lavanya, for educating us, our participants, about different aspects which we don't know about cardiology and cancer correlation and so many other things. Thank you so much. Thank you, sir, for asking very powerful questions and giving us a lot of knowledge. Thank you.
Thank you. Thank you.
Thank you.